Hello and welcome to my channel. This is Pritesh Jadhav and today we shall be dealing with an interesting topic. This is known as an unintentional or an involuntary weight loss. Weight loss of more than 10% of the body weight is significant, and especially if it is unintentional. Also, weight loss in a previously healthy individual is often a harbinger of underlying systemic diseases. The routine medical history should always include an inquiry about changes in weight, rapid fluctuations of weight over days, or sudden or loss or gain of fluids, whereas long-term changes usually involve the loss of tissue mass. Loss of 5% of the body weight over a period of 6 to 12 months should be prompt to evaluate for further investigations. Gradual weight loss is physiologic in persons over the age of 80 years, but this demographic group also has a high risk for malignancies and other serious illnesses. We'll understand a brief about the etiology. The principal causes of involuntary weight loss can be assigned to four general categories. Firstly, a malignant neoplasm. Secondly, chronic inflammatory or infectious diseases. Thirdly, metabolic disorders. And fourthly, psychiatric disorders. In older persons, the most common cause of weight loss is depression, cancer being followed by it, and benign gastrointestinal diseases being the third. Lung and gastrointestinal cancers are the most common causes or malignancies in patients who present with weight loss. In younger individuals, diabetes mellitus, hyperthyroidism, anorexia nervosa, infections, especially HIV or AIDS, should be considered. Clinical features. Before extensive evaluation is undertaken, it is important to confirm that the weight loss has occurred. Up to 50% of claims of weight loss cannot be substantiated with findings. In the absence of documentations, changes in the belt notch, size, or a fitting of clothing may be helpful to determine the loss of weight. The history should also include questions about fever, pain, shortness of breath, cough, palpitations, and evidence of neurological diseases. A history of gastrointestinal symptoms should be also obtained. This includes eating difficulties, dysgeusia, dysphagia and difficulty to swallow, difficulty to eat, anorexia, nausea, and changes in the bowel habits. Travel history, use of cigarettes, alcohol, and all other medications should be reviewed, and patients should be questioned about previous illnesses or surgery as well as diseases in other family members. Risk factors for HIV should also be assessed in such patients. Signs of depressions, evidences of dementia, social factors including isolation, loneliness, and also the financial issues that may affect the food intake should also be considered. Physical examination should begin with the weight determination and then the documentations of the vital sign. The skin should be examined for pallor, jaundice, turgor, surgical scars, stigmata of other systemic diseases. Evaluation of oral thrush, dental diseases, thyroid gland enlargement, lymphadenopathies, and other respiratory, cardiac, and abnormalities should also be performed. All patients who are men should have a rectal examination, including that of prostate. All women should have a pelvic examination as well, and both should be tested for stools for occult blood. Neurological examination should include mental status assessment and screening for depression. Initial laboratory evaluations with an appropriate treatment based on the underlying cause of weight loss is essential. If an etiology of weight loss is not found, careful clinical follow-up is recommended, rather than persistent undirected testing in such patients. The absence of abnormal laboratory tests is also a favorable prognostic signs for weight loss. Some of the screening tests for an evaluation of a patient with involuntary weight loss are a CBC with a differential, electrolytes, calcium, glucose, renal and liver function test, urine analysis, thyroid stimulating hormone, a chest X-ray, and also cancer screening. Testing for HIV upper and lower GI endoscopy, abdominal CT and MRI chest should also be done. Now we shall see a brief about the treatment. Treatment of weight loss should be directed at correcting the underlying physical condition or with a social circumstance affecting the patient. In specific situations, nutritional supplements and medications like drobenol or growth hormone may be effective for stimulating appetite or in increasing the weight of such patient. If you found this video informative, please consider subscribing to this channel. Thank you.